Hello, good afternoon, everybody. Welcome to our Lunch and Learn series for April. Today we have Dr. Connie Fugate, one of our pediatric faculty, to present on her research and ongoing studies and talk about some of the opportunities that would be available for students in the near future. So Dr. Fugate, I'll let you have it.
Thank you so much. So just kind of an overview of the Department of Pediatrics and how research is set up within our department. I am the director of clinical research in the Department of Pediatrics, and I in some way, shape, or form am knowledgeable or participate in the vast majority of the research that happens in the department. And part of that is just so that we have a central repository, I guess, so to speak, in my brain and in some notebooks that I have of the various projects that are going on, and so that we can work in a way which is not duplicative and a way that is synergistic with one another. Research within the Department of Pediatrics is very driven by the personal and professional goals of our residents and our faculty. And then also we have quality improvement initiatives as well that are driven by a variety of factors, both the personal and professional interests of those who are part of the Department of Pediatrics at all levels, but also, outside things such as regulations, changes in professional guidelines and things like that will often drive our quality improvement initiatives. We do a variety of types of scholarly work. And we collaborate with others in that process. And so typically, just from a medical student and resident standpoint, I think it would be better if I just kind of went over what a resident's experience would be like, and then to know that the medical student's experience is somewhat similar. I'm not quite the same because where you are in training is obviously different, and then you have different barriers to participation and research than maybe the faculty or the residents do, just given your time constraints and other requirements for graduation. So what it looks like for a pediatric resident is they meet with me at least 3 times a year, and more often if necessary, but formally we meet 3 times a year. The very first meetings that I have with them during their intern year, we're going to talk about what their personal and professional interests are, where they've been, what they did in undergrad, what they may have done in between undergrad and medical school, what jobs they've held, what research they've done in the past, what advocacy work they've done in the past, what their professional goals are at that time, knowing that they might change because they often do change as you go through the training process. So do they want to do a fellowship? Do they want to specialize in any way? Do they want to go directly into practice? And what does that practice look like? And how can we help support them in reaching their personal and professional goals through scholarly work and advocacy work? Our residents do have to do both. A scholarly project, which takes many different forms, so I'm using that really as an umbrella term, and they have to do a separate advocacy project in addition. They're both longitudinal projects that take about 3 years to do. And many times the hope is that they can combine those 2 projects so that they really only have one literature review that can really inform both projects as they move through the process. And so it generally takes us about 6 to 9 months to really pick their topic of their research. And again, that gives them some time to get settled into their residency and allow them to adjust, because that is a big adjustment to go from medical school to residency. And especially if you didn't go to the residency associated with your medical school, which many of our residents are from other places. And then we begin to decide what's our methodology. And because the topic and the research question or their aims really do drive kind of the methodology of the project. Quite frankly, research supports from the larger institution also can drive that, and then barriers to research can drive our decision making around that as well, because just like medical students, we have certain curricular requirements to graduation, and a resident schedule is quite challenging, given that they change places just like a third and fourth year medical student each month. And so, you know, we take into consideration the practicalities and the logistics of research as well. And so all of these things I'm talking about really also apply to the medical student, right? When I'm working with medical students, they typically are interested in some of the work that we do in the Department of Pediatrics or some of the work that we do in the Family Health and Nutrition Clinic, and they've reached out to me. And so what we'll do is we'll set up a meeting, and I want to get to know the student. I want to know what is their personal passions, what's the professional desires, what are their goals, what research have they done in the past, what advocacy work have they done in the past, what are they interested in doing. And so when students come to us, it's just like when the residents come in as interns, right? It's really, we want to support you and your personal and professional goals and help you to achieve your aims within what is practical for you as a medical student, and with what we have available from a resource standpoint within the institution and within the Department of Pediatrics. So the type of scholarly projects are pretty wide ranging. Obviously, they have a pediatric slant regardless. They really are working with the pediatric population. And so again, using that umbrella term of scholarly projects, it may be that they are doing a quality improvement project, right? Which isn't strictly, if you think of research, within the realm of research, right? And it typically is a fairly modified quality improvement project given the time limitations that either a resident or a student has. But we're doing those PDSA cycles, and we're certainly impacting practice. And oftentimes those quality in projects will actually evolve over multiple generations of residents and be passed down. And students will typically, who are involved in those quality improvement projects, given a very specific role within those projects, because students generally just have a month in the summer or a month of rotation in the third and fourth year. And so trying to make sure, again, that it fits what you can do as a student. But so we may have one resident do one PDSA cycle as their project and then pass down the next PDA cycle to the next resident and so on. So it doesn't look like a project maybe that I would do as faculty, but it's certainly all of the steps are there. Then we have trials that are intervention related to where we have blinding and an intervention that takes place. I really try to steer students and residents away from those because those are big projects and they take a lot of resources and time. And really, in my mind, those are more a fellowship level or an attending level project. But we do have residents do those. And typically those are going to be projects that roll forward multiple generations of residents. And typically the residents that take those on are still doing those from a distance when they are entering either into practice or into their fellowship. We do have residents we have a lot of retrospective chart reviews to see how we're doing. What's our baseline? How are we meeting the gold standard for quality and in practice? And then retrospective chart reviews after interventions have taken place, after we've either changed our curriculum in order to address a particular need, or we've changed our clinical practice or added another service line to just make sure that we're always staying up to date, meeting those gold standards, both for education and for clinical practice. And so we might do the initial chart review and see how we're doing, and then develop an intervention strategy with another resident just focusing on that intervention strategy, and then a third resident coming back and reevaluating once time has passed and things have had an opportunity to really give us some good data, looking at it again and seeing if we really achieved what we hope to achieve and that forward progress of meeting those gold standards. So we do quite a bit of those. We have lots of case studies. So residents who are on rotation with us in their third and fourth year are going to see a lot of pathology, a lot of interesting pathology, and are going to really have that opportunity to see unique cases. And so they'll write up those cases with the attendings that they worked with. Some of those attendings may be core faculty, so they are employed by OSU in the Department of Pediatrics, and some of those will be faculty that are at OU, or they will be members of our clinical adjunct faculty. So they may be employed in private practice or by St. Francis or some other entity. We always follow good clinical practice guidelines within research, within human subjects research. We do require IRB to be consulted on everything, even if we're thinking let the IRB make that determination of exemption. That's part of the reason that I touch almost all the research projects, is because I sat on the IRB for so many years and I have a good understanding of regulatory. And so I can be very helpful from just understanding what resources are available and what the guidelines and expectations are for ethical research. We do clinical research trials with pharma, but typically students do not participate in those, and residents typically do not participate in those. Although students who rotate with us will see that we're doing them and interact with the investigators of the study and with the coordinators of those studies. So you will learn about them in a clinical environment. You just typically are not going to be part of that process because of all of the logistics and the IRB implications that come with those large research trials that are funded by pharmaceutical companies. Trying to think if there's anything else. I'm sure there's things I'm missing, but I want to make sure that you guys have an opportunity to ask me questions. I know that I've worked with all of you, or I'm about to work with some of you in advocacy and scholarly work. So the Department of Pediatrics does, again, a lot of collaborative work. That's very important to me. That's one of my personal and professional interests, is that we all play well in the sandbox together and that we support each other to drive forward the mission of the university and to really serve the citizens of Oklahoma. And we can only do our best when we work together well. And so you'll see that our residents and therefore the students do have opportunities to work collaboratively with people in the community and others throughout the entire OSU system, and even in some of our other universities, because I do a lot of collaborative work there as well. And so if something seems in that first interview to fit your personal and professional interests, and I know somebody who is not in the Department of Pediatrics that is working in that area, I'm definitely going to help you make those connections. I think being a connector is an important part of the work that I do. With that said, I'm going to stop talking. What do you guys have for me?
Thanks, Dr. Fugate. So I do have a question for kind of my classmates as third years coming up into third year, going out into our rotations. So if somebody does a rotation at OSU Peds, how can they get involved in research, and what might they be expected to do if they get involved in research, like data collection or analyzing data, kind of along those lines?
So typically the first step to do research in the Department of Pediatrics is just to send me an email. And then the next step in that process is we're going to set up a time to meet, maybe face-to-face, maybe over Zoom. They don't have to be on rotation in the Department of Pediatrics. They don't have to have done their core rotation with us or even do, an audition rotation with us to reach out. In fact, most of the students who have worked with over the years have not done a rotation with us for their pediatrics portion, right? And so they just reach out to me. We'll have a talk. And I'll just learn more about them. And really, it's very much the next steps are guided by those logistics, practicalities, the students' barriers, but mostly by their personal and professional interests. So once I find out what they're interested in, then I'm going to kind of go through my bank of information that I have, knowing what everybody else is doing. And I typically begin to connect them with individuals who are already doing research. Sometimes students will do their own projects as well, but typically the students that are reaching out are wanting to explore pediatrics as a career. And so it's always better if they can then interact with the residents and build those relationships and with some of the attendees. And I always think they get a better idea of our department and of our culture, and they can be able to get references for not only our program, but other pediatric programs that they may be applying to when they build those relationships with us. So if I can, I find a project that really helps make those connections with other pediatricians or pediatric residents so that they can begin to develop those relationships, and they can have mentorship, not just from me, but from others within the department. And so that's typically what it looks like. What do they typically do? Because again, you guys are limited typically in your time because you're rotating all over the state and you're moving, every 4 weeks and all of that kind of stuff. Typically, you're involved with more of the data collection side or writing up of manuscripts or abstracts and literature reviews and things like that. Things that can really be done in that more succinct amount of time that you guys have. Whereas our residents are going to have that totality of the project, right? They're going to see it from the very beginning in the conceptualization of the project, through the literature review, through the methodology and design, to the data collection, the data analysis, the writing up, the presentation at professional conferences, the whole 9 yards, right? Students typically, unless it's a case study, can't get into each one of those time points within the project, right? They typically fit within one area, and where they tend to work best, just because of the limitations of medical school, is in that data collection portion or that literature review portion.
Awesome, thank you. And I do have one follow-up too. So I think a lot of students are intimidated by getting into research because they don't have lots of research experience yet. So do you expect students who are coming to you to have lots of robust publications already, or what are your expectations when they reach out to you?
No, I do not. I have a time where I work with a lot of people all over the country from who are experts in all sorts of things. And I had the opportunity to go do some training at an Ivy League school, and lots of researchers there. And one of them asked me what was my interest in research. And I said, I have no interest in research. And that was my response. I don't think they appreciated my joke, but I'm a clinician, right, who does research. And everything that I do is, regardless if it's in my clinical world, in my educational world, or in my research hat, right, in whatever hat I'm wearing, right, is meant to be for the benefit of the citizens of Oklahoma, right? How does what we're doing serve the mission, right? And so then when you come back to your specific question, research has a place, right? We want to be data driven. We want to practice evidence-based medicine, and the evidence we have today, it may not be the same 10 years from now, right? Medicine is ever changing and rapidly changing. I think we saw that incredibly over the last year, right? And so it's an important part of what we do to support clinical medicine. So it's very, very important research is. But is it important for everybody to do research? No, right? We all have our own roles to play. And part of my job and part of our job as an institution is to help students to be able to critically evaluate the medical literature, critically evaluate the guidelines, and then to, if they have an interest in research, to really help them to better understand methodology and to better understand the implications of it, the ethics and legal considerations around research. I take all of that very seriously, the information that we learn in city training. So my job really is to support the novice researcher in becoming, in our particular institution, a clinician who understands the value of high quality research and understands how to critically evaluate the professional literature. And gathering experience in research helps you to get that skill, right? So I don't anticipate that students are going to come in as biostatisticians. As a matter of fact, if they did, I would freak completely out because I would know so much less than they did, right? I go to Micah for things like that, right? He's the expert in methodology, right? I connect people to who knows how to do things, right? Just like John is the expert in literature review, right? And understanding how to access all those incredible resources that the library has. I'm not that person, right? But I can help you translate that knowledge to clinical practice. And so that's really, I see where we are. And so students don't have to have any research experience. But that's part of the initial evaluation and question answer session, right? Is just, hey, what is your experience? And because that'll help me to guide them to the right project, right? And what do you want to do? Do you want to be an academic researcher? Is that what your professional goals are? And if so, let me help you get to the right person, right? Who can really guide you and help you get to that doctoral level or that postdoc level, things like that, right? Or are you just really kind of wanting to explore the career in pediatrics more, right? And so again, do they have to have experience? No. And that's our job to support them in really developing those skills and to the end of whatever they hope to achieve from it.
Awesome, thank you.
Mm-hmm. One of the things that's important to know in pediatrics department, we do these scholarly projects, right? But again, they're coupled oftentimes with advocacy and outreach projects. So sometimes students may come to me under the question of, I'm interested in research, but when we go through this talk together, what they discover is that one of our outreach and advocacy projects or community-based work that we do is actually something that fits them better. And so if students also have an interest in doing advocacy or outreach with the pediatric population, that's also something that we can certainly support. And I'm over both of those. And so I'm pretty aware of what's happening in both of those realms. And so again, when students interview with me that first time, it's not really an interview, it's just me trying to figure out what they're interested in, right? So I just make the right connection for them and I can support them. But it may be that some of them end up doing one of these other projects that wouldn't fall under that strict umbrella of research. Any other questions from anybody else?
Maggie or John or Tully? I would say our answers were thorough to Kyle's questions. That really, I had 5 questions written down that you covered all of them. So you have examples of like shorter duration, longer duration. So we did a medical student needs assessment at the end of the fall or so, and medical students reported that they, have the first year summer where they have like 2 months where they don't have anything to do. But then they also during the year reported they had approximately 4 to 7 hours on a weekly basis to do research. So if somebody came to you and said, if we could do half a day a week for a long-term project, are there any examples of stuff that you have done in the past that may be something they could contribute to on a weekly basis like that?
The last project that we had a medical student do longitudinally was a food insecurity project. And we actually had a postdoc in human sciences coupled with a pediatric resident and with a student who was interested in pediatric and wanted to specialize. I cannot remember what he specialized in. And that was one project that they did, but actually our food insecurity projects, we had a separate project going on at the same time. So there was another resident and they had to work collaboratively because their projects had some overlap. And then we've had multiple projects that have rolled forward from that. And yes, he was able to participate longitudinally. And it fit his personal and professional needs quite well, right? He knew very, he had a really good idea of what he wanted to do when he came to me, right? And as far as his training, he knew he was going to go on to fellowship. So when that happens, whether it's a student or a resident, then I look at he also did have experience in research. And so I look at, again, what's their experience level? What are their professional goals? And I will steer residents and students to more robust projects if it seems to fit them better, right? Rather than, a resident who maybe doesn't have an interest in fellowship, a student who doesn't have an interest in fellowship is really trying to just explore the area of pediatrics, hasn't ever had any research. We might start them kind of where all beginning researchers start. Mm-hmm. And that's in that lit review and data collection phases, right? All of us started there. And so, but yeah, it certainly can be done. Again, is very much student resident driven. Now I rein them in, don't get me wrong. I go, okay, I'm sorry, that can't be done. We don't have, $20,000 to support that project, right? But I do look at the resources, but really try to really honor their personal and professional goals. So if honoring those personal and professional goals means they're going to do a longitudinal project, then we will try to figure it out with them. Now that does mean they typically need to start earlier, and they maybe need to think about it, starting it in between their first and second year and continuing it through that third year or fourth year, right?
Okay, well, thank you, Dr. Fugate, for your presentation, and we will link your email to our YouTube site and make sure everybody is aware of how to get a hold of you if they want to do research in pediatrics. Again, thanks.
You are welcome. And I appreciate all of you who are on this call that I work with, and for all your support of our students and residents when I give out your name. So thank you so much. I appreciate it. Let me know if you need anything, okay?
Okay.